The city's water supply was switched in an effort to save money. That decision is blamed for a deadly outbreak of Legionnaires disease at McLaren, Flint. We were the first to share with you Tuesday a letter from the CDC to the state health department sharing McLaren, Flint has actually been a source of Legionella bacteria for more than a decade, since 2008. That is 6 years prior to the city's water source switch. The letter is dated December of 2019, but was never made public. Our Ann Perret obtained it, dug into the facts. She joins us now live from outside McLaren, Flint. And Ann, several experts reach out to weigh in on what you uncovered.
Yes, now since we first aired the contents of this letter, I have had water experts from across the world connecting with me. If you remember, I mentioned in our coverage yesterday that this new information begs the question, did we see an uptick in Legionnaires' disease cases in 2014 and 2015 as a result of the city's water source switch, or did the switch just exacerbate an already existing problem?
Very likely what happened was the switchover exacerbated conditions that were already there.
Tim Keene is a consulting engineer on Legionella. For 2 decades, he's been tasked with identifying issues within water systems, specifically to determine if that system is a source for Legionella growth.
McLaren already had issues with their water systems when it was audited by CDC that identified temperature issues, circulation issues. So those were all in existence prior to the outbreak.
The outbreak following Flint's water source switch in 2014. A total of 90 Legionnaires' disease cases were reported over 2014 into 2015. At least a dozen people died. The state saying a majority of the cases are connected to McLaren, Flint. The hospital has maintained the outbreak was because of the water switch. But in this letter we first shared with you Tuesday, the CDC says the hospital has been a source of the Legionella bacteria since 2008 through 2019. Keene wasn't surprised the issue has persisted for more than a decade. He says due to McLaren Flint's end of the water distribution system, the hospital has a high water aging issue.
That means you're at the end of the system, and you know about stuff rolling downhill. So you'll not only have less disinfectant, you'll have crud building up. I've flushed out these mains at high velocity where you get this septic, nasty crud that's coming out because it's settled over a period of months.
So Keene says that's how the water source switch exacerbated McLaren's existing problem. We know the Flint River water wasn't properly treated, and without the corrosion control, Keene says the chlorine used to treat the water and control the bacteria becomes non-existent at the end of the distribution where McLaren was located.
This lack of disinfectant residual turned what was likely few cases unidentified into a large cluster.
And I did reach out again to McLaren asking for an on-camera interview today. Instead, they sent me that the water source switch is to blame for the uptick of Legionnaires' disease cases, even noting the timing of the letter being made public. A spokesperson issuing this statement saying, quote, "It is disappointing that our hospital is once again being forced to defend itself against this false and misleading narrative advanced by these individuals and their defenders as they prepare to face criminal charges, in some cases for a second time." Now, it is important to note that the state shared with us yesterday that in 2020, McLaren Flint did not report any healthcare associated cases of Legionnaires' disease to them. Live in Flint tonight, I'm Ann Perret, ABC 12 News.
And thank you. Meanwhile,